Great. So my name is Sarah. I work at the Canadian Centre on Substance Use and Addiction in Ottawa, and I'm a research and policy analyst. And as you probably know already, I'll be talking a bit about the Brain Story, which was started by the Alberta Family Wellness Initiative, and that we're hoping to expand to a national level.
Great, and I'm just going to flip the presentation screen over to Sarah and we'll get started in just a moment. And I will send the slides out to everybody after, and the presentation is being recorded, so you will be able to view it uh, at a later date.
Okay, I just had a quick question. Can everyone see the presentation? Lisa, can you see the presentation right now?
Yeah, I'm seeing your
But yeah, are you seeing the presenter view as well?
I'm seeing your presenter view. Yeah.
Okay, I think I'll probably just have to take that off then, because I just have a single screen
Oh,
in
you're
front of me.
okay.
I, I think that probably makes the most sense. Alrighty, that's okay. Agreed?
Yeah, whatever works for you.
Okay.
I'm yeah. Or I could run it from my screen if you need to be looking at your notes. If it's
No, it's not super important. So
okay.
yeah, so I'll get started like that. So basically I'm gonna talk about a project we've started here at CCSA about the brain story. So our overall goal is to help reduce the burden associated with substance use and addiction across Canada, building on what we know about the link between childhood trauma and substance use. First, I'll just provide a bit of background about what the brain story is. I'm guessing probably a lot of you are already familiar with it, and if you're not familiar with the title of the brain story, I think a lot of you will be familiar with sort of the concepts in it. So essentially, it's about how early childhood experiences shape our brains, and then how this influences lifetime health, both mental and physical lifetime health. So one of the key parts of the work focuses on research about how adverse childhood experiences, called ACEs, can influence risk for later physical and mental health. And this includes addiction, which is obviously the focus of where I work. And so, as I mentioned, the Alberta Family Wellness Initiative in the past decade has worked to develop a really excellent online resource that includes a course called The Brain Story. And they've developed this resource that's super available to, like, very accessible to both non-experts and experts. A lot of really important material. What that material is they talk about how the brain develops, on how especially social interactions contribute to brain development and what they call brain architecture. The course talks about the effects of stress, both tolerable and toxic stress, and sort of different factors that interplay with that. More like equally as important, it's an opportunity to learn about evidence-based approaches for the prevention, intervention, and treatment of childhood adversity and what we can do with the knowledge about brain development. Talks about the neurobiology of addiction and goes into the science of how that develops throughout the life course. And also importantly, it talks about how to build resilience in the face of stress, especially toxic stress. So to expand a bit more on the part of brain development, so we know that life experiences affect the architecture of the developing brain. Importantly, positive experiences can help build strong brain architecture, creating a solid foundation for learning, behavior, and health. And so the course presents a lot of material for how we can kind of contribute to these positive experiences and mitigate negative experiences or toxic stress that adversely regulate brain development, increase risk for later physical mental health. So I'm just going to move quickly through these sort of background brain story slides, and then later in the presentation, I'll talk about what CCSA is doing with this knowledge. So if I am moving quickly through these slides, that's why. And all of this information is available online as well. So for those of you who aren't familiar with adverse childhood experiences, The original study, ACEs study, was conducted in the late 90s with a really large group of people. The findings about this were pretty surprising because this was actually largely a sample of pretty well-off upper middle class people, largely white as well. But they found that about 2 in 3 people reported at least one ACE, and about 1 in 5 reported 3 or more. So examples of ACEs include physical, emotional and sexual abuse, emotional neglect, a mother who is treated violently, substance misuse within the household, an incarcerated family member, as well as household mental illness and parental separation or divorce, which we know is the rates are quite high. So in some respect, that finding is not surprising. And so they went on to show that there's a really strong dose-response relationship between the number of ACEs that a person has and sort of the amount of negative health and well-being outcomes that they experience later in life. And there's a bunch of research focusing specifically on the link between how many ACEs someone has and sort of the likelihood of developing substance use disorder, sort of other behaviors related to addiction. So for example, ACEs can predict early initiation of alcohol use. There's this recent study in 2017 looking at the association of ACEs with higher risk of mental and substance use disorders in older adults over 50 years of age. ACEs are associated with continued tobacco use during adulthood. In adolescence, a recent paper looked at the association with non-medical use of prescription medications. And I think this study was also in 2017, each ACE in this population studied increased the likelihood of early initiation into illicit drug use by 2 to 4-fold. Sorry, that was 2003, looking at neglect and household dysfunction. So what can we do about this research and this knowledge? So we know that building resilience can help tip the scales towards better health and reduce risk for mental illness and addiction. Helping families build the foundations of resilience, including skills and abilities that can help them adapt in stressful situations and hardship, can mitigate these outcomes. And one important aspect of that is supporting caregiver relationships, including parents. So so far, especially in the Western, especially in BC and Alberta, I think the brain story has gained a lot of traction. So some of the sort of larger scale policy and practice outcomes that I wanted to touch on briefly. One of is an investment by the Alberta government in 2017 into the development of early learning and childcare centres. In BC, there was the development of the Child and Youth Mental Health Substance Use Collaborative. That was recent as well. In the US, this work has also gained a lot of traction, and the core story of the brain has been incorporated into principles of early childhood brain development that have helped inform investment in early care and education. And I can't remember where I pulled this from, but so there's sort of just overall, there's a lot of research that has demonstrated that investing in early childhood development, it costs money, but in the long term, it saves money. So now I'm just going to slow down a little bit. So what do we want to do here at CCSA? Our project, so we have a 3-year project that we've started where we want to promote awareness and understanding of the brain story science across Canada. And we're hoping to, most importantly, we're hoping to facilitate its application to policy, practice, and public awareness by promoting the brain story certification, which was developed by the Alberta Family Wellness Initiative. And secondly, we're going to be hosting the Brain Builders Lab in March of 2019. So the audiences that we're hoping to target for this is going to be like a workshop event. Includes a whole gamut on this slide here. we're hoping to have early childhood educators, healthcare providers, including physicians, nurses, pre and perinatal care providers, social workers, mental health and addiction service providers. This work is also very relevant to law enforcement and criminal justice professionals. So, for example, in Alberta, they've embedded the brain story into their training for criminal justice professionals. Um, Indigenous community leaders and elders. This work is very important for those communities in particular. Staff who work in child welfare organizations, community and housing organizations, as well as workplace health and wellness program administrators, to name a few. Well, more than a few. So what does this Brain Builders Lab look like? So this will be in March 4th and 5th, 2019 in Ottawa. Um, Attendees will have the opportunity to access expertise related to how the brain story applies to their field of work. They'll have the opportunity to engage and exchange ideas. So what I'm going to go into detail in the next couple of slides is that we ask attendees to have sort of at least a vague idea of a project that they can develop in their sphere of work based on the brain story science. So this will be an opportunity to exchange those project ideas and develop them more fully, as I have here. So develop project plans. And then also really important is that these project plans will receive implementation support over the following 2 years. And this will be in the support in the form of mentors who will be introduced at the Brain Builders Lab, as well as knowledge mobilization support from CCSA. So just to give you all a bit of an idea about the format of the Brain Builders Lab. So as I mentioned, it will mostly be a workshop format. We plan to have small groups of people break out into groups. The groups are going to be based on a combination of where people are from across the country, and also what field of work they are in, or kind of what the project they plan to do is. So, for example, if it's incorporating the brain story into some sort of training for healthcare practitioners, then that could bring different practitioners together, and then we would group them together based on sort of jurisdiction if necessary as well. There will be experts available at the lab to answer questions related to projects. These experts will come from a diverse background of expertise. So for example, there might be someone from neuroscience and sort of epigenetics. There might be someone who has experience implementing the brain story in their community. Someone who has a lens related to sex and gender specifically, or Indigenous communities specifically, for example. So I think that will be a really valuable resource for people who are developing these projects. As I mentioned also, there'll be mentors available for practical questions, and we hope that these relationships will continue over the following 2 years of implementation of the project project plans. There will also be a high-level panel, mostly policymakers across different levels, so provincial, territorial, or municipal policymakers. So they're going to that panel will be at the end of the second day. They're going to provide sort of high-level input into the project plans about feasibility and kind of overall thoughts. So in order to attend the Brain Builders Lab, there's 3 main requirements that we ask participants to do. So the first is complete the brain story certification. That's available through the Alberta Family Wellness Initiative. We have a special link that you need to sign up for that. Secondly, we ask that attendees demonstrate buy-in from employer. So just basically signing a commitment agreement form that basically tells us that you're going to have enough resources, granted enough resources, whether it could just be time to move forward on the project, to basically just ensure that people are not just going to be working off the side of their desk on these projects, and that they actually there's actually an impact, like the project is actually completed in the following 2 years. And finally, we need participants to tell us a bit about their idea beforehand, so that we are able to group people together in appropriate workshop groups. And we understand that, especially for those who have not completed the brain story yet, it might be kind of difficult to have a concrete idea, but a vague idea will be enough to allow us to sort of work out the groups for the lab. So just to give you a few examples of what potential brain story projects could look like. So some of them could be based on just communicating the science and embedding the science in professional development and training. Developing interventions is another example. It could be adapting the materials for specific cultures or communities, implementing the ACE questionnaire in different fields of practice, something focused on early childhood development, engaging youth, and even focusing on adults with addiction and mental health needs, because it's not just about the child's brain in isolation of its environment. You know, we really have to have a wide lens to address substance use and addiction, for example, using what we know in the brain story. And so moving forward, over the following 2 years after the Brain Builders Lab. So obviously that will involve implementation of the projects developed at the lab, and projects will, so we hope that, the hope is that projects will provide the opportunity to monitor and measure impacts of applying the brain story to policy and practice, because thus far, there's not actually a lot available in terms of actually being able to sort of look at especially related to substance use and addiction. It will be really interesting if we're able to provide some numbers about, you know, this, we implemented this, and then the rates of this issue decreased. And then finally, this is also about growing the network of champions for trauma-informed policy, practice, and public discourse related to trauma-informed practice. So I think I've covered everything. This is my contact information in case anyone has any questions about what I've presented, and I think we have some time for questions as well.
All right, thank you so much, Sarah. I think a lot of people online probably, like you said, know about the science around ACEs. So I'll just open the floor to any comments or questions, and maybe, if you're interested in the workshop, or if you've done any work around that already. Has anybody online actually done the brain story certification, or was aware of? And I know that there's some folks from Alberta online, so.
Yeah, actually, I'm here. It's Bev Len from Alberta.
Yeah.
And
So,
I know quite a few people who've done the brain story. It's through the Norleans Foundation. It's all funded through Norleans family. And I have to say I've been to some presentations, evaluations, and I mean it's very interesting in the actual day-to-day work that I do in children's mental health in Edmonton. I don't think we've been, honestly, a few people have gone to the brain story, but it hasn't become a big part of what we do. And it's just a matter of having the time, getting people away, and taking advantage of it. But I would have to say we haven't at this point.
okay.
Hello?
Yeah?
Yes, this is Deborah Pace. I'm with Alberta Health Services, and I'm also First Nations from Southern Alberta, the Blood Reserve. The brain story was undertaken by the whole school division on the Blood Reserve. All of the teachers were required to sign up and go into the brain story. And what happened after that was a need for more information so they could actualize some of the stuff that they learned.
Yeah.
with it. So they had a conference, and they engaged the community. And I think that with that, the community is wanting more. They're wanting to understand, because we have a big opioid crisis going on in southern Alberta. And substance abuse and addictions has been an ongoing issue. So there's a lot of things that the elders and teachers and the community members are really interested in getting more involved and trying to figure out what they can do to do the next steps. But I think that next steps requires some research. So I will email you and maybe get some more information.
Yeah, that would be great.
It's one thing to you have all of this. You have sort of the first part of the information, but then it's like, now what? Now what do we do with it? So I think that workshop and designing some projects, some very specific, and they don't have to be big, right? It's only 2 years, so it's hard to do a big project over 2 years. So just some small, very specific projects that could come out of that, and start an evaluation. And Sarah, is the hope that some of these projects, sort of will be spread, like that, they'll sort of be that proof of concept and be able to be spread to other areas or other?
Yeah, I think so. I think there's sort of two things. So one of them is we're hoping that some of the projects are going to be fairly large scale and could be incorporating the brain story into like a national sort of training materials for nurses, for example, across Canada. So that would be one way that the scope of the brain story would kind of be far reaching. Yeah, and I think the other thing that you touched on is this does give us the opportunity to actually follow these projects closely. I don't think we're close to the idea of having projects that aren't necessarily going to be completed within 2 years, but I think the goal is to really be able to follow them closely from an evaluation standpoint, which will be useful for sort of advocating for more research on practice and policy that works, because right now it's kind of a lot of academic population, like there's a lot of academic research, but I think there's not a lot in terms of like measuring the impact of these community-based projects, for example, on indicators like rates of substance use. And I think some of those are maybe kind of too far out of the scope because you're gonna have to kind of follow that over a generation. But I think this does give us the opportunity to do that, and also to so for example, after the 2 years, we'll be able to showcase these projects, which will then hopefully plant seeds in other people's brains for like, okay, they did that project, that could be related to something that we can do in this community or this area. Because right now it's, I think it can be challenging to think of like, okay, this science makes sense, but like, what do I do with it? So I think that this project the implementation of these projects will help with that in the future.
Great, I agree. Any other thoughts or comments out there? There's people from different sort of sectors. I think we have education online, we have community, we have, I think we have some inpatient. Any sort of other perspectives that?
Hi, it's Brenda.
Yep.
Just a question. I understand Brain Story takes about 30 hours to complete. Does that sound about right?
Yes. Yes.
And has there been any thought of making a shorter, more concise version, say for different areas? So, for example, say community versus mental health substance use?
So that would be an excellent project. So that's definitely, and that's actually one of the challenges that we're experiencing now is that especially people working in the field, um, like that's it's a lot of people don't have the capacity to take that on. It's definitely a lot, like it's a lot of work, it's a lot of information. So even actually, to be honest, for myself, I got to complete it sometime soon too, but I haven't actually finished it yet either. So yeah, it is a big undertaking, the 30 hours. I think they do a good job of condensing a lot of relevant information, and especially the background science is very complex, and they do a great job of condensing that. But I think you could have sort of targeted sort of versions for people who work in a certain area versus another. So for example, like when we've reached out to people more in the criminal justice field, like it can be a challenge to sort of reframe the brain story in a way that so that they understand like why it's important to what they do. So I think I'm just going to write that down, but hopefully hopefully someone's going to do that at the Brain Builders Lab.
Okay, thank you.
It's Lisa again. I'm just wondering, so do you have like sort of in your proposals, or I know that when people are first applying to go to the workshop, they're not going to have a full proposal or they're just going to have the concept. Um, will there be a requirement for sort of a knowledge translation piece within the proposal once, at that workshop, to figure out how to, we have a project, this is how we're going to implement it, but how are we going to share? Is that just built in within the CCSA work, or are they required to build in a bit of that component as well?
So that will really be the goal of the lab, to work out the proposal and project in detail.
Mhm.
And we definitely don't expect people to have detailed project proposals beforehand, especially if they've only just signed up for the brain story training. And because and it could evolve too. So as they take the course, there might be a light bulb that goes off, and they could change their
Yeah,
project as well. That's certainly a likelihood. But it's really we really just need a vague idea so that we can kind of start planning out these workshop groups. So that's the main purpose of that, as well as making sure that people are committed to not just showing up to the lab, but kind of do
get
uh,
through. Yeah.
yeah, following through on
Yeah.
something concrete.
And how many people do you have capacity for, or how many projects do you think you have capacity for? Or
So we have capacity for 50 attendees. So those are the people, 50 attendees. That doesn't necessarily mean 50 projects. So already we can see that there's going to be a few cases of people who work together, either two to four or even five people and it could be that are going to work on a project together, in which case there could be a workshop that just has two groups of people working on similar projects on in different provinces, for example. So that it will not be super regimented in terms of the number of projects. It's really just the number of people, which will be about 50 in total.
okay. And when do people have to apply by?
That would have been really good information to have on the slide. So we're hoping to have all interests people notify us of their interest with sort of the vague idea by early December, at which point we're going to start confirming and registering people for the conference. So we're still in the stage of just trying to get the word out and yeah, trying to get as many people interested as possible and even just sign up for the brain story certification, whether or not they have a project or not that they could move forward with.
So if it's a bit of a tight timeline for folks who haven't already done the certification. So could they have just signed up and started the
Oh yeah,
certification?
so the certification is not a requirement to sign up and register. We just need people to commit to completing it before the Brain Builders Lab.
Okay.
So,
Perfect.
which is why I mentioned that. So they might have sort of a vague project idea, but that will probably change by March as they go through and complete the training.
Okay. Sorry. Yep. That makes sense.
Yeah, 2 weeks is definitely not. That would be disaster.
Okay. So, does anybody else out there have thoughts or any other comments? I mean, it doesn't have to be about the Brain Builder Lab or about the Brain Story certification, but even around ACEs and around any work that you've done in that. You know, someone had spoken before about screening for ACEs, and maybe they're not on the call today. But. Okay, so well, the presentation has been recorded, and we'll send out all the links to the appropriate, to the Brain Story certification for those who have never seen it before, and to the CCSA links for the workshops. And if there's no other questions or comments for Sarah, then we can probably let her go. Alrighty, thanks so much, Sarah.
Great. Thanks again for having me, and to everyone who tuned in this morning. Thanks.
Thank you. All right. Anybody else online? We didn't really have much more on our agenda for today, but I'm wondering, does anybody have any updates or anything new going on in their organization or practice that they wanted to share, or anything coming up that you think is important for others to know? You can just jump in. Everybody's very quiet. Alrighty, well, I will send out the links to everything, like I said, and I will see everybody or talk to everybody in a month or so. So I'll give you half an hour of your life back, and talk to you soon.
Thank you.
Thanks. Bye-bye.
Bye.